There is so much talk about chromium. Y'all, it is all over the place. It is online. People are talking about it. They're asking about it. Many people are taking chromium supplements. Let me know in the comments, by the way, if you are taking chromium and why you're taking it. Many companies are marketing chromium to, say, help you with diabetes or help you lose weight. But of course, the question is, does it actually help you do that? Guys, I'm Dr. Jen Caudle. We're going to jump right in, okay? First thing you should know, chromium, it's an essential mineral, which means it's something that we need. Our body does need it in trace amounts, albeit, so we don't need a lot of it, but we need it. The good thing is it's present in a lot of foods that we are likely eating, okay? And it's also available as a supplement. Now, we're talking about the supplement form today, okay? Now, what does chromium do in the body, you may be wondering? Now, there are studies that suggest that chromium does potentially enhance the action of insulin, which is a hormone. And we know that insulin is useful when it comes to helping us regulate our blood sugar. Chromium has also been noted to be involved in the absorption of carbohydrates and proteins and fats. And chromium might also have antioxidant effects, okay? Thus, all of these things I just said are some of the reasons why people say, okay, chromium is going to help you with diabetes, it's going to help you with weight loss, etc. The problem is, it's not that simple, and there's a lot we just don't know still. So let's break this down like sort of one piece at a time. Let's start with the diabetes piece, okay? Should you take chromium for diabetes? My answer to you is I wouldn't, and I'm not recommending it to my patients. Why? Because we don't fully know that it's going to help, especially with someone who doesn't actually have a chromium deficiency. So let me go to the NIH right now and give you some information that they say. They actually say that the FDA only allows one qualified health claim for chromium picolinate dietary supplements. This health claim, the one that they allow, says, and I quote, "One small study suggests that chromium picolinate may reduce the risk of insulin resistance and therefore possibly may reduce the risk of type 2 diabetes. The FDA concludes, however, that the existence of such a relationship between chromium picolinate and either insulin resistance or type 2 diabetes is highly uncertain." Did y'all hear me? Yeah, I'm going to go back and read that again. I just scrolled back up. The FDA concludes that the existence of such a relationship between chromium picolinate and either insulin resistance or type 2 diabetes is highly uncertain. It's highly uncertain. There's just so much we don't know about it. That's why I say I wouldn't take a supplement for it. And then the American Diabetes Association, in its 2010 diabetes guidelines, concluded that because studies have not definitively shown that chromium supplementation benefits people with diabetes or obesity, the American Diabetes Association, cannot recommend such supplementation. This is a big deal. And why did they say that? They said that because there was conflicting evidence from different studies. Now, if you're watching this video on YouTube or Facebook, you may be looking at other chromium videos, and you're going to hear doctors and other people say, oh, there's a study that said that chromium does this or that. One study is not necessarily everything. We need multiple studies, multiple good studies, well-powered trials to actually be able to make large, widespread conclusions. I'm not saying that there aren't studies out there that suggest that chromium helps with sugar and diabetes. I'm saying that there are just not enough good studies to say that it definitively does that. Does that make sense? And that's where you really need to not be fooled by people who come on and what we call cherry pick one study and say, oh, this study says it works, therefore. That's not how it works in medicine. We want more than one study to say something works, to know that it works. And we need that study to be a good study, a well-powered study with enough people, a representative sample, reproduced over and over again. Okay? Don't be fooled. So what we're saying about chromium and diabetes is we just need more information. That's all. Which is why I say when it comes to would I recommend somebody taking chromium for diabetes, I say I wouldn't. Because the data, in my opinion, is not fully there. All right, let's talk about weight loss, okay? All right, so when it comes to body weight, we know that chromium might amplify the action of insulin. Also, some scientists have proposed that chromium could reduce the amount of glucose converted to fat and increase protein synthesis and hence muscle mass. And so you're probably seeing people online and stuff talking about chromium and whether it's exercise or weight, etc., muscle mass, etc. Some preliminary research also indicates that chromium might reduce food intake, hunger levels, and fat cravings, okay? So hence like the weight loss and body composition sort of piece here. Now, once again, I love this, okay? Who doesn't love this? I love it as well, okay? But this is the thing. We still need a little bit more. According to the NIH, they say that overall, research suggests that supplementation with chromium, mainly in the form of chromium picolinate, reduces body weight and body fat percentage to a very small but statistically significant extent. Small is small, but statistically significant means that it was significant. However, these effects have little clinical significance. Once again, the data is still raising the question of how significant, how widespread, how solid this information and evidence is, okay? Which is why I say that at this point, I wouldn't spend money on a chromium supplement for diabetes control or weight loss. I think that there are better, more surefire ways to do it to get your diabetes under control and get your weight under control than buying a chromium supplement where the data is a little bit iffy in some places, okay? And that's really what this is all about, right? I'm not here to like hate on chromium. I'm just saying, all right, well, there's some data. It's not always the best. It's a little If you have the choice between going with that and going with something surefire, why wouldn't you go with the surefire? And what I feel is surefire is, we know that what helps get diabetes and weight in control is eating a healthy diet, exercising, keeping your numbers under control, taking prescribed medications if your doctor recommends them, and doing so many other things. I have videos on the DASH diet, which is a great diet for blood pressure, the Mediterranean diet, which is a great diet for heart health, exercise. And the other thing too I'll mention is there are a lot of great medications on the market that help people lose weight that are evidence-based that also have other benefits. What I'm saying again, I'm going to repeat this again because I'm not a chromium hater. I'm just saying, why would you go with the question mark when you can go with the surefire? We know what actually helps people get their weight and their diabetes under control. My advice is to go with those things, not the others. Let me know what you do. I'm actually really curious. Let me know what you think. Let me know what videos you've seen, what they say, etc. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. On YouTube, please subscribe to my channel. Click the little bell for updates. On Facebook, please like and follow my page. And also, guys, I am on I'm on Instagram. I'm on WhatsApp. WhatsApp, Instagram, TikTok at Dr. Jen Caudle. Also, I do this free weekly health newsletter. I would love for you guys to sign up for it. It's at drjencaudle.com. Remember, with everything that we talk about, such as things like this, it is all a matter of risk versus benefits. Supplements can be super, super, super expensive. And if you're not getting your bang for your buck, and by the way, we haven't even delved into the issue of people who are deficient in chromium versus not. If you have a chromium deficiency, do I want you to not be deficient? Sure. And could that possibly mean taking a supplement if your doctor recommends? Sure. But for people who have enough chromium, the data is not out that taking it is going to help these other things. Go with the surefire. That means talk to your doctor. Okay. That's really what that means. And if you're interested in taking a chromium supplement, talk to your doctor about that too. Get their advice. All right, guys, I'll talk to you soon.